I'm honored to be here today with all of my colleagues and to be presenting. I have no disclosures, first and foremost. I'm a social worker. We usually don't. So I'm going to be presenting on caring for the whole patient. As social workers, we are trained to consider our patients within the context of their environments. So we want to think about your relationships, your work life, your family life, spirituality, hobbies, your past, as well as your future. In cancer care, we want to ensure that we're supporting our patients in as many of these domains as possible. So here at Johns Hopkins at the Sidney Kimmel Comprehensive Cancer Center, we have oncology social work, such as myself. Most cancer diagnoses have their own designated social worker. We have oncology chaplains. We have living with cancer programming and the Hackerman Patz Patient and Family Pavilion. When we work with our patients, we think about the whole team and what everyone has to bring to the table. So at the top there, we have the things I previously mentioned, your social workers, chaplains, cancer programming. We also help with transportation and housing assistance. A lot of health insurance plans can offer transportation. Counties can as well. We have local centers for housing during treatment, and we can also give information on general housing. Our pharmacists, who you just heard from, patient financial assistance, does a lot of work with insurance. As was mentioned, open enrollment is coming up. Next week is when open enrollment starts for Medicare, Medicaid, as well as Affordable Care Act plans. There's a lot up in the air right now in the news about some of these programs. It is our job as social workers to stay on top of those current events so that we can be a resource to help explain changes that may be coming. We have behavioral health. We offer counseling. We can also get our patients connected for substance use or misuse clinics, patients, caregivers, other family members. At Hopkins, we have a psychiatric liaison nurse, specifically in oncology. We can provide information and assistance with any legal things. We do advanced healthcare directives. I'm often found running around the inpatient floor with a stack of them, trying to get people to fill them out. It's a vital component to your health. We also have notaries, advocacy, and we can get you connected to legal programs. Financial counseling, as I mentioned, with insurance, as well as just finances in general. We have home care coordination. They can help with getting you set up with in-home nurses paid for through your insurance, as well as any durable medical equipment that you might need. Care management are inpatient nurses, and we work closely with a palliative care department, both inpatient and out. As social workers, we do psycho-oncology care. So that is what I explained at the beginning, which is how do we care for you as a whole person? When you're going through cancer treatment, it's not just the medications, it's not just the appointments, it is, are you still working? How can we help get you into treatment and get you connected to FMLA resources if you're working? Explain what your benefits and your legal rights are. We do a lot of the psychosocial assessments. So an assessment is just an interview, questionnaires or surveys that we use to try to get to know our patients better. This helps us as social workers to guide you through any supports you may need. It also helps us communicate with your medical teams. Someone may tell me, I keep getting scheduled for appointments on Tuesday. I can't come in on Tuesday. My child's school ends at 12 o'clock on Tuesdays. And so we can help relay that information to get people the type of care that they need so they can keep doing their things outside of being a patient. Our counseling at Johns Hopkins is pro bono on a short-term basis. Sometimes patients just need 1 or 2 sessions. I have several patients who I meet with on a biweekly basis, individual as well as couples. Family meetings and advanced care planning and goals of care is all a big component of what we do. At our goals of care meeting for treatments, if we're going to change it, if a treatment's no longer working, if our goals of care entirely have begun to shift, social worker is a vital part of that team to have those conversations. And we look closely at social determinants of health. We don't want anyone going through cancer treatment if they don't have access to food at home, if they need help with finding stable housing. So when we assess our patients, these are all of the things that we are trying to assess for. Ideally, we don't go through a checkbox on a piece of paper. We just have a conversation and we get to know you better through the conversation. We also help with school-age children. That's a big one, with talking to younger children about a cancer diagnosis. We have resources like books, coloring books, even picture books, to help explain to children at different lifespans what a cancer diagnosis is and what it means to go through cancer treatment. As I mentioned, we have those legal and work concerns we help with. Our chaplains do a fantastic job with spiritual and religious needs and concerns during treatment. Complex family systems, we all have them. And sometimes things can just be a little more challenging on top of a cancer diagnosis. And so we're here for those conversations as well. At Hopkins, we have a Living with Cancer survivorship program. We consider survivorship to be day one of your diagnosis and throughout the trajectory of your care and aftercare. Every June, we have a Cancer Survivors Day. It had been virtual, but this past June, we were able to bring it back to in person. It's open to all types of cancer diagnoses for patients, caregivers, family, and friends. We do educational events with webinars and conferences. We have a monthly newsletter. And we have our resources page, which is a wealth of information. Many of our resources are similar to the resources you can find at the AIM at Melanoma's website as well. So as I mentioned, we do a lot with transportation during treatment, especially if someone is receiving one of the more specialized cares, like a TIL procedure. You need to be a certain distance from treatment. You cannot drive when you're on treatment. You're the main driver for your family, or you're the only driver in your family. How are you getting to and from appointments? So a lot of these problem-solving types of things are the conversations that we have with our patients. We also have a new program called MAPS. It is a mentorship and peer support. What we heard from a lot of patients was that they wanted to talk to someone who's had the same or a similar diagnosis as they have. And so this is a way to get our patients connected to someone who has also gone through their exact type of treatment. They can talk about, yes, I also had those side effects similar to what Megan shared about. And they can be a great guide and resource for that. So anyone is welcome to join the MAPS program as either a mentor or looking for a mentor. Pat's Patient and Family Pavilion is basically a home away from home for those who need to be closer to treatment. It's short-term, temporary housing. The room rate started about $60, and for an entire apartment, it's $85. It's much better than the hotel rates that you'll find around here. And it is only for cancer patients. So they have communal dinners with a chef who comes once a week. It's a really nice, welcoming environment. That's something that myself or my other colleagues can help get patients into. If you are not at Johns Hopkins, there are a lot of organizations called Hope Lodges. And those are in major cities throughout the country that also offer housing opportunities for patients undergoing treatment. You might want to take some screenshots or photos of these if you want some resources in particular. I put the main ones that I refer patients to. These are generalized resources. They will help with emotional support. They have support groups virtually that they do. Also, general information about your type of cancer in particular. And I should mention, these are national programs. The Wellness House is a national program, but I put the Maryland one up in particular. A lot of patients use them for in-person support groups. Financial resources. Keep taking photos, keep taking your screenshots. These ones are fantastic. They can help with any number of things. A lot of them do copay programs. They will do assistance with transportation if you're too far from a catchment area for other options. They can help with prescriptions. And don't worry, there's even one more page of financial resource options available. And so most cancer centers have clinical social workers on staff. So if you're not at Hopkins and you haven't met with a clinical social worker, don't be shy to ask your team. They likely will have one. We're a great resource to help get you through all the other aspects of your cancer care beyond just the medication.